Hello, everyone, and thanks for joining back again for one of our new videos. And today we are going to talk about a very common problem, but in a different way. We are going to talk about gallstone disease, and we all have heard about it, and we know that the treatment usually is removal of the gallbladder. But we are going to talk about some of the common questions that come up in our mind when one is diagnosed with this particular disease. So, what are the two most common questions that people ask once they know that they have a gallstone disease, that they have stones in their gallbladder? So, first is whether they need surgery or not, whether the surgery is a must or not, and the second is laparoscopic versus open. And most of patients today already know that laparoscopic is an option, but we are going to talk about because this is a common question when which patients ask, and this video is there to help you bring clarity on why laparoscopic is better and when open will be offered to somebody. Okay, so a little bit about the risk factors for developing gallstones. A little bit of background will help us understand the disease. So, first of all, what are the common risk factors? What are the risk factors which are there but are less common? And is there any association of heredity, like family history, in developing gallstones? So the most common risk factors are a female, usually in her middle age, in 40s or 50s, slightly obese, and has a fatty diet. So this picture gives a high risk for developing gallbladder stones. Second is, um, I would say that a lady, when she gets pregnant, at that time, the metabolism of fats alters because of the hormonal changes, which induce formation of stones in the gallbladder. There are some other less common causes like Crohn's disease or some surgeries like resection of the stomach, resection of the terminal part of the small intestine called the ileum, because of the altered mechanism of bile acids and bile salts, because which happen because of this surgery. Then there are some hereditary diseases which are actually blood disorders, which is hereditary spherocytosis, thalassemia, and sickle cell disease. And in these diseases also, the the red blood cells are broken down much quickly than a normal person, and the pigment that comes from the red blood cells, those pigments induce formation of the gallstones. And then obesity alone is not a hereditary factor, but if somebody has obesity along with gallstones, and that kind of picture runs in the family, obesity usually BMI more than 30, then if that thing runs in the family, we can take it as hereditary association for gallstone disease. For gallstone disease. Now coming to our questions. Our question is: do all gallbladder stone patients need to undergo gallbladder removal or cholecystectomy? And the simple answer is no. Not all patients need to undergo. Reason? Let me start by saying that if we scan 100 people on in of normal population, then around 35 to 40% of the people will have stones in their gallbladder. Uh, but all of them will not be having any problem. So that group of patients which are not having any problem from gallstones need not undergo the knife. When do somebody needs to undergo the knife? Well, when patients have one of these, when they suffer from one of these points, when they have gallstones. So one is acute cholecystitis, that is, uh, now the stones are causing trauma to the gallbladder, and there is swelling in the gallbladder, which is now patient can perceive as pain. So patient is having acute inflammation, or in our medical language, acute cholecystitis. What are the other causes? Well, when acute cholecystitis has turned into a more severe form or has turned into a complication, like pus formation in the gallbladder, which is called empyema of the gallbladder. When the stones in the gallbladder have slipped from their position inside the gallbladder to outside and into a duct, as you can see in this particular diagram, the stones in the gallbladder, they have slipped down into this fine duct called the common bile duct, and it gets stuck here. So when it gets stuck at this point, it causes blockage of bile traveling into the intestine. And bile is a, you can say, is an enzyme, is acidic in nature, and when it gets stuck in this particular place, in this particular duct, it can cause infection, which can travel back to the blood, it can travel back to the liver, and can make patients sick. This is called cholangitis. If it gets stuck here, it can also block the pancreatic duct, and the enzymes, again, pancreas produces enzymes which digest the food, and when this duct gets stuck, uh, again, there can be swelling of the pancreas called pancreatitis, and again, it can be a serious condition. So these are this is the second thing, when gallbladder stones have moved out of its position. So that is the time when these firstly these stones will be taken care of, but after that the you will be advised to remove get your gallbladder removed. Another set of patients is the bariatric surgery patients. So when they undergo bariatric surgery, sudden weight loss can induce formation of stones in the gallbladder, and when they are undergoing this major surgery, that is the time to remove it, so that uh, complications or need for surgery for gallbladder in the future is removed. There is one set of patients which, even if they are asymptomatic, are advised to undergo the removal of their gallbladder if they have stones. That is a diabetic group of patients, for the simple reason that the alarm system, that is the nervous system of our body, is hampered, becomes weak with diabetes, and when it becomes weak, it cannot induce pain when as in a normal patient. So if a patient is having, I should say, if they are having swelling in the gallbladder, if they are developing any complication in the gallbladder, they may not be able to elicit the pain. The alarm system may not go off earlier, and there are more chances that the patient will move towards the complications from gallbladder stones. So that is why these diabetic patients are advised to undergo cholecystectomy even before they develop any symptoms. And then there is another small subset of patients who have gallbladder polyps. They are not stones; they are small growths in the gallbladder. They are benign growth; they are not cancerous. But when they are more than 10 millimeters in size, they can change into malignancy, and that is why if they are significant in size, patients should undergo cholecystectomy. But polyps usually do not cause pain. So you should also know. So now we have just spoken about the indications for gallbladder removal: acute cholecystitis, complications, diabetes, bariatric surgery, and polyps. So apart from empyema, apart from uh, cholangitis and pancreatitis, there are some other complications also that you should be aware about. One is gallbladder perforation. So what happens is, when there is constant swelling, constant trauma from these stones to the gallbladder, then this is a very thin wall which the gallbladder has. It is 3 or 4 millimeters normally in thickness. So this wall can get eroded, and the content, that is the bile and the gallstones, they can slip out of the gallbladder, and they can this can be usually a very serious condition. Normally, bile is wherever, if the bile is out of its place, as I told you, it is very acidic, and it can start uh, affecting, harming, causing swelling and pain of nearby organs like the liver, the stomach, and the intestine. This part of the intestine is called duodenum. Get it can start affecting all these nearby organs. What else can happen? Well, yes, apart from causing polycystitis, where the gallbladder becomes shrunken and does not and stops performing its purpose, there has been an association between gallbladder stones and development of cancer. if the stones are present for a very long time. So, to prevent all these complications, if the patient has any symptoms, initial symptoms, they should undergo a cholecystectomy. Okay. Now coming to our second main question, that is laparoscopic versus open. So we all know laparoscopic is commonly the surgery offered for cholecystectomy. It is in fact the standard of care for gallstones. Simple reason that it is a very safe surgery. Uh, this duration of surgery is not very long in uncomplicated cases. The patients have a very small incision as compared to the open surgery, because of which patients have less pain, less hospitalization, less medication after surgery. Most of the patients actually go home the next day, sometimes even the same day, and they can rest at home, but they need not be in the hospital requiring injections. So, what part of the patients should be offered open surgery? Well, the open surgery should be reserved for only the difficult cases, and if somebody is suspecting, or your doctor is suspecting malignancy, that is cancer of the gallbladder. Cancer of the gallbladder in only very small subset of patients can be offered laparoscopic, but most of the patients will require open surgery, because in this other nearby organs are also removed, including a part of the liver. So difficult surgeries will be mainly those where complications have happened. That is, the gallbladder has either perforated, pus has formed into the gallbladder. All those patients are the patients which usually will present with a difficult surgery, because the nearby organs, because of the complications, mainly as I told you, the liver, the intestine, and the stomach, they, along with the blood vessels. As you can see in this diagram, these blood vessels in the red and this duct system in the green, all these things can become stuck, can get jumbled up, and surgery proceeding laparoscopically may not be possible. So, difficult cases and the risk of malignancy are the two uh, scenarios where patients may be offered upfront open surgery, or may require conversion from laparoscopic to open surgery. So I hope I have addressed these two questions well, and all of you are most welcome to come back to me with any questions. You can email me and you can text me, and I will be happy to answer all your questions. Thank you very much.